Aloha. Aloha kakahiaka. Good morning. Glad to meet all of you. My name is Jim Deagle. I'm the Chief Strategy Officer. I'm pinch hitting for Mike Brembus, our CEO, this morning, who got tied up on a call that he can't break away. And so I got the call from the bullpen, and here I am, and I'm glad to spend a few minutes with you this morning. So first of all, let's talk about Maui Health. We are affiliated with Kaiser Permanente, but we are not a Kaiser Permanente hospital. So how many of you have either worked with Kaiser Permanente or know Kaiser? There's several hands here. So Kaiser really, when you look at it, Kaiser is a health plan. It's a national health plan that happens to own a distribution arm, which means they have hospitals for all of their health plan enrollees, and they have clinics that they own, and they contract with a group of physicians in each of the area that they have a presence. It's the Permanente Medical Group, and it's called basically a closed model system, a health maintenance organization. So that's how Kaiser operates in all of their markets across the United States. It's kind of a closed system. Their hospitals are primarily for their members, and their physicians take care of their members, and then sometimes they take care of other patients who show up in the emergency room or sometimes get referred to the hospital. So that's how a normal Kaiser system works. There is a Hawaii market here, a Hawaii market based up in Honolulu. They have a hospital, they have clinics, etc. And that market also owns the Kaiser Clinics, perfect, thank you, here on Maui as well. But we are not a pure Kaiser hospital. We're affiliated with Kaiser. The best way to describe it is Kaiser leases the operation of Maui Health System and is doing so for 30 years. Okay, so another way to look at it is they are the managers. They own the day-to-day operations. But the assets, the hospital and some of the physical assets, remained owned by Maui Health System, which is a division also of the Hawaii Health Systems Corporation, okay, which is a historically state-run system. So this is a new relationship in the state of Hawaii. It's kind of what I would call a public-private partnership, and we are now into year 5 of that 30-year relationship. And boy, time really moves very, very quickly. So we get the best of Kaiser. We get the best of their infrastructure, their IT, their system, their processes, etc., while at the same time being able to be a community hospital, and sometimes we are able to kind of do things that are really our way, our local community health system way. Because we take and see all patients on Maui and from Lanai. And we have physicians who are both Kaiser physicians and not Kaiser physicians. So we're a traditional community health system, community hospital in that way, similar to Queens, similar to Straub, or other hospitals throughout the state. So it's a very, very unique relationship that we have with Kaiser, and we continue to learn about each other and grow together going forward. So 60 years, we were owned by the state, and then effectively the operations were leased to Kaiser. So we have Maui Memorial Medical Center here, which is effectively a sole provider, sole community provider hospital, a regional referral center, 219 beds here, and basically all of the major specialties that you would expect for a sole community hospital serving a population of about 165,000 permanent residents on Maui and Lanai. Now those 165,000 permanent population doesn't represent the population that we normally see on the island, as you probably all know. So on any one day, there's anywhere between 40 and 70,000 visitors on the island. So think about that. If there's 70,000 or sometimes more, and your permanent population is 160,000, almost you're seeing another 50% population on the island at any one period in time. So we're a very busy hospital. We frequently run at a very high census. That census sometimes is diluted a bit in that we have certain patients that are hard to place upon discharge. They're called waitlisted patients, and they're waiting to go either to long-term care or to foster care or to homeless shelters or whatever. So we have a fair number of patients who actually stay with us for quite a while. Sometimes impacts our capability to accept inpatients and that. But we're a very robustly busy hospital. Upcountry Maui, we have Kula Hospital and Clinic up there. That's a very storied institution. Started out as a TB sanatorium in 1937. It's in a beautiful setting up there, very bucolic up there. Primarily long-term care beds, although we have a 24-hour emergency department, we have a small clinic, and we sometimes see some inpatients for very short stays, and just a couple of patients at the most. So it's called a critical access hospital up there. And then across the channel, we have Lanai Community Hospital on the island of Lanai with a population base of about 3,500 people. There are more deer on Lanai than there are people these days. But that hospital is very small, about 12 long-term care beds, an emergency department, 24-hour emergency department fully staffed by physicians. And they do have the ability to admit an inpatient, although that's very rare. Usually if somebody needs hospital care beyond the emergency department, they're transferred. They sometimes go up to Honolulu, or preferably they come our way here to Maui Island. And that. So these represent our three main hospitals, and then we have another entity called the Maui Outpatient Clinic. It's located next to the hospital over on Maui Lani Parkway, and that's where our provider-based clinic is. So many of the physicians that we recruit here frequently wind up over in the Maui Outpatient Clinic. So this is our leadership team. This is Mike. Mike has been here since the inception of the agreement with Kaiser Permanente. This is the rest of the senior leadership team. Wade Ebersol is our Chief Operating Officer. He just joined us. This is week number 4 for Wade. Joyce Tamori is our Chief Financial Officer. Joyce is we call her our Maui Compass sometimes because she was born and raised here and has a long history of working on the island, so she really brings unique perspectives for us. Dr. Michael Shea, on the left side there, he is our Chief Medical Director, sometimes called a Chief Medical Officer. He is a pulmonologist by training and a critical care intensivist physician. Been on island for about a decade, and Mike works still some shifts in the ICU, so he keeps his hands intimately tied into the day-to-day operations. Myself, I've been here 2 years. Melinda Sweeney is our Chief Development Officer. Has been here about 2.5 years, comes from the Northern California market. Tara Cole is our Director of Human Resources. Tara has been in the state on and off throughout her career and has spent the last 10 years in the state. Previous to Maui, she was up with Kaiser Permanente in Honolulu. And that represents a bulk of the senior leadership team. There are a couple of other members on that team as well that will be updating slides in the future months so that you can see who they are too. We use pillars to guide much of our operational activity. Those pillars are listed up here, as you can see. Quality is key, obviously, to this organization. You heard that previously when Leslie was addressing quality. So a lot of focus on quality. Quality and safety is paramount and is always a priority for us when we make decisions as an organization. People. It's all about people. It's about each and every one of you. It's about me. It's about our patients, their families. It's about the community. It's about physicians. So we are really focusing significant effort and time on relationships with people. Okay? So that remains a key pillar. Service. It's all about services, the services that we provide, the programs and services we want to add. That's part of my responsibility in the organization. Financial health, you cannot be a successful organization if you don't have what we would call a normalized operating margin. So sometimes you hear, no margin, no mission in some respects. So we just need to make sure that we stay financially healthy and balance our needs to ensure that we can continue to deliver quality care. And then last is growth and reputation. We are in a growth phase. We have seen significant revenue growth over the last couple of years, primarily related to the fact that we've been very successful in recruiting physicians to this island. And that success continues to increase. For those of you who have lived on Maui for a while, we're starting to see a lot of in-migration into the island from the mainland. I sometimes think people feel it may be safer out in the middle of the Pacific on a rock, far away from the mainland or anywhere else. But we're seeing significant growth in the organization, and we're working very hard on improving our reputation. Years ago, there was a lot of question around quality and service. That has improved markedly over the last couple of years for sure, and continues to improve as we move forward. So these are the pillars that really guide our work as an organization. A couple of things around facility operations. I'll just let you read this here. We've done some renovations, not only here at Maui Memorial, but also up at Kula and at Lanai. We continue to have a variety of activities planned for all of the campuses and that. One of the things that we know we need to do here on the Maui campus is we have to update our master site plan. Because with this regular high census, we know at some point we're going to need to add additional beds. We know we need another medical office building, and we know we need a parking structure. Okay, the greatest challenge operationally here is parking, and if you haven't experienced that yet, you will soon. And so all the more reason really to take a look at our entire campus and our facilities and develop a plan going forward to ensure that we're able to deliver the services and take care of our employees at the same time. We spend a lot of time with community events. Our website has been redesigned. We're on social media. We do a lot of communication, not only to external audiences, but to each and every one of you. These regular internal communications, whether it's our daily digest when we're in surge times, like we are again, COVID surge times, in our third wave here on Maui. And so we have really invested in updating how and the style of communication and the various vehicles of communication. And a lot of that feedback came from our employees and our physicians, and the quest for more transparency. So you'll see us continue to focus on that a lot going forward. Strategy, areas of growth and opportunity. You'll see some of these areas that we continue to recruit with. We have 2 neurosurgeons on the island. We have a very robust neurology department as well. Cardiology, we continue to broaden and deepen our service lines there, and these other services here. The bottom one here, trauma. For some of you who have maybe come from larger communities, we are a trauma level 3. We behave like a level 2, so we have committed to become a level 2 trauma center. And we would only be the 2nd level 2 trauma center in the state, behind the level 1, which is Queens Punch Bowl, Queens Medical Center Punch Bowl there. So we're on a journey to become a level 2 trauma center. Holo'imua. Holo'imua basically means moving forward together, kind of as one. Holo'imua. And this was an initiative that was started about 2 years ago, which really says we're going to move forward by recasting our mission, our vision, our values, and create an intentional culture within our organization. And we're going to move together and do that in conjunction with the community. And so we launched this initiative. We then got busy with Joint Commission. Then the pandemic hit. Pandemic didn't disrupt operations in healthcare at all. Yes, it did. And so for us, we are shortly going to be relaunching this initiative, Holo'imua. Our strategic goals, this is where I spend a lot of my time. working with our senior leadership team and the board to get very focused on where we want to go. These are the 5 strategic goals: growing our culture, becoming more of a value-based organization, enhancing our partnerships and innovation, both internal to the organization and external to the organization, maintaining our financial health and having a robust philanthropy program, establishing a regional referral center here for Maui Memorial, and strengthening our reputation and our identity going forward. So you see some overlap with the pillars of the organization, but this is where we're really kind of pointing our future direction. And underneath each of these goals, we're actually developing objectives. Underneath the objectives are tactics, metrics, so that we can measure our progress and show the board and the community that we are living our strategic plan and not just creating a strategic plan. And just like everywhere else, the Delta variant is showing up pretty strong on this island. But our COVID patients in-house have remained relatively flat over the last 7 to 10 days. So we're encouraged by that. We're very proactively involved in the community to encourage people to get vaccinated, to practice social distancing, to wear your mask, and take care of your ohana and your keiki and your kupuna on this island. That's really, really important to us. So, all right. Well, mahalo nui loa. Thank you very much. We welcome you to the organization. Feel free to raise any questions or contact HR or Mr. Rembis if you want. You can find him on email, and you can send him an email. He will respond. He's really good at that. And so on behalf of the board and senior leadership, welcome to the organization. Have a good, successful rest of your day in orientation. And we'll see you around. And as we say, ahui ho, until we see or meet again.
Thank you.
All right? Yeah.